Good afternoon, everybody. Welcome to Option Period 2020. This is the time of year where you can make changes to your state benefits. Option period opened October 1st and it runs through October 31st, 2019. So first we'll talk about some of the changes that are coming up for 2020. First, Aetna HMO is not an option for 2020. Aetna is not coming back as a health provider. So if you have Aetna now, you are going to have to find another provider, or you will automatically be defaulted to Health Choice High if you don't go in and make a positive election. Refer to your guidebook that's attached to this presentation, and it will show you the changes from 2019. All plan changes are highlighted in bold text, so they should be pretty visible in your handbook. The benefit allowance for 2020 has increased for some employee groups. The employee and child, and employee and children groups have all had a slight increase. The employer group went up about $20 from 2019. The employee and child went up about $23, and employee and children went up about $37. This is per month increase to your benefit allowance. Premium increases, all carriers have increased their rates slightly over 2019. Community Care HMO went up about 8.5%. Blue Links had the lowest increase at 1.8%. Global went up about 14%, and the Health Choice High 3.5%. Basic 4.5%, and the Health Choice High deductible plan went up about 5%. There was no change to the TRICARE supplement. And these increases are across the board increases. So I just took the 6 categories from 2019 versus 2020 and calculated those percentages. So yours may have gone up a little bit less than what's shown here, or maybe a little bit more. One of the questions that we get asked a lot is, what is the difference between an HMO and a PPO? So let's start with the HMO. An HMO is called a Health Maintenance Organization. And under an HMO, there are no annual deductibles, so you don't have to meet a deductible before the plan starts paying. You do have to select a primary care physician or a PCP. This is the doctor that will navigate all of your medical issues. HMOs typically have lower premiums than a PPO, and all copays are expressed in dollars. So if you have a hospital visit, it might be $250 versus a PPO where they're expressed in a percentage. The insurance company will pay 80%, you pay 20%. So it's a little bit easier to budget under an HMO maybe than a PPO. A PPO is called a Preferred Provider Organization, and it does have an annual deductible depending on which plan you choose. We'll determine that deductible. You can choose any physician within their network, primary care or specialty doctor. You just look them up in their catalog and call, make an appointment and go. You do not need a referral to see any doctor in the network. PPOs are sometimes a little bit more flexible than an HMO is, and copays are expressed in a percentage rather than a fixed dollar amount. The Health Choice High, for example, is 80%. The insurance company will pay, 20% the individual pays. Basic plan, you pay 50% and the insurance company pays 50%. Okay, so the health plans returning for 2020, Blue Links, HMO, Community Care, HMO, Global Health HMO, and Health Choice PPO, and Selman Company are the TRICARE supplement providers. So Blue Links is a division of Blue Cross Blue Shield of Oklahoma. They've been with the state, I believe, 3 years. As an HMO, they do have zero cost, so there's no deductible for coinsurance, no cost for primary care physician visits, no cost for home health visits or routine lab and x-rays or the diabetes program. They are available in all 77 counties in Oklahoma. So they have the largest HMO network in Oklahoma. And there are no referrals required under this plan. So you don't have to have your primary care physician refer you to a specialist. You can just call your specialist on your own and make your appointment. Customer service is available 24/7. And the contact information is in the back of your handbook. They are at least 20% lower than the other HMO options. Okay, and here's the contact information for Blue Links. There's a customer service phone number and a website. Make sure on the website you do the Blue Cross Blue Shield of Oklahoma.com /state. That is a specific website for state employees. If you don't put in the /state, you'll just go to the regular Blue Cross Blue Shield website. Okay. Community Care is another HMO available in eastern Oklahoma, the Tulsa, Muskogee, McAllister area. They are affiliated with the St. John and St. Francis Network in Tulsa. I'm not going to spend a lot of time on this as we don't have anybody enrolled in the community care program, but also they do not have a annual deductible, and you can see some of the other items on here. They're at no cost to you. Okay. Global HMO is coming back for 2020. This is their 16th year serving the state of Oklahoma. They are also available in all 77 counties in Oklahoma. They also have $0 cost for physician care visits, primary care visits, $0 deductible, $25 urgent care copay, and a $500 maternity delivery copay. Pharmacy is $10 for generic drugs on the Tier 1 generic plan, and they have a discount for gym memberships. Specialty scans are $250. That's a CAT scan or an MRI in a preferred facility, and $750 in a non-preferred facility. Typically, the non-preferred facilities are hospitals where they have a higher cost of operating expenses, so they charge a little bit more than a freestanding facility would be. And remember, this is the cost that you pay, not what the insurance company pays. So it would be worth your while to find a freestanding facility versus getting an MRI or whatever at a hospital. It'll save you $500. The outpatient and inpatient surgeries have gone up. Notice they're highlighted in bold. They'll be highlighted in bold in the benefits guide as well. Okay. Here's a partial listing of the hospitals that participate with Global Health. This is not an exhaustive list, so please visit their website to find out if the hospital near you is participating in their network. Note on the bottom, out-of-network care is not covered except for emergency or urgent care. So if you go to a non-network hospital, the HMO will pay nothing. So you will be responsible for the entire cost of that visit. So please make sure that the hospitals that you go to are part of the HMO network. Their contact information is on the screen. They also have an app available. If you want to download the app, you can do that. The Health Choice plans, Health Choice is a PPO, a preferred provider organization. They do have 5 plans, the high and high alternative, basic and basic alternative, and the high deductible plan. They have a variety of plans that fits everybody. The Health Choice High plan has the lowest deductible and the lowest out-of-pocket maximum, and simple office visit copays, $30 for a primary care physician, $50 for a specialist. Health Choice Basic is called first dollar benefit. So the insurance company will pay the first $500 in expenses. You would pay the next $1,000 in expenses, and then you split the balance 50-50 after that once you've met the deductible. And the high deductible health plan has the lowest premium, but as its name implies, it has a high deductible. It's $1,750 for an individual. So just a snapshot of the 3 different plans here. The Health Choice High plan has a $750 deductible and $2,000 for a family. And in this case, a family is 3 or more. Co-insurance is 80-20. Once your deductible is met, the insurance company will pay 80%. You're responsible for the remaining 20%. Your out-of-pocket maximum is $3,300 for an individual and $8,400 for a family. And copays are $30 for primary care and urgent care and $50 for a specialists. The high alternative plan, if you notice, has a higher deductible. It's $1,000 for an individual and $2,700 for a family. Health Choice Basic is $500 first dollar coverage. Again, they will pay the first $500. You will pay the deductible the next $1,000. And then after that, the insurance kicks in and you split any remaining costs at 50-50. Insurance company pays 50%, you pay 50%. The out-of-pocket for an individual is $4,000 and $9,000 for a family. And the high deductible health plan has a $1,750 for an individual and $3,500 for a family. And that does include pharmacy in that deductible, towards that deductible. Your out-of-pocket is $6,000 for an individual and $12,000 for a family. Once the deductible has been met, the plan mirrors the Health Choice High plan. And the alternative plans on the bottom, if you do not complete the smoker's attestation, which means that you or a member of your family uses tobacco products, you'll notice your deductibles are higher. Okay. Health Choice does have some value-added services. Bariatric surgeries are now covered. You have to be within the with Health Choice for 12 months before you can take advantage of the bariatric service. The Health Choice Select program is a program that's set up to where you don't pay anything for select procedures on the day of the surgery. The hospital, doctor, anesthesia, all the other expenses are covered the day of the surgery. They also offer a complex care management program and telemedicine, and that's coming in 2020, where you can visit your doctor virtually through Skype or maybe even over the phone. Okay, so bariatric surgery, there's several procedures available. You must be on the Health Choice plan for a minimum of 12 months. There are 5 convenient locations throughout the state, and they are subject to the deductible and copays. The Health Choice Select program is part of the Health Choice program. So if you are enrolled in any of the Health Choice programs, Health Select is already part of that. You don't need to do anything to enroll separately. Again, 100% of certain services and procedures are covered for the day of the surgery. You still have to pay your copay when you see your specialist before surgery, and any follow-up visits after the surgery, you would still be responsible for the copays, but everything is covered the day of the surgery. This is an excellent program for typically routine surgeries. They're all done at no cost to you. There are specific doctors and facilities that are part of this program. So go to the healthchoiceok.com website, click on the Health Select program, and it'll show you which doctors and facilities are participating in this program. The care management program is designed to help you with complex medical issues. If you have multiple illnesses and are seeing multiple doctors and getting multiple prescriptions, this program is designed to help you navigate all that. And again, it is part of the Health Choice programs. Telemed is coming in 2020. It will be available 24/7, 365. So when you're sick, you don't have to leave your house to call your doctor. They can cover all basic physician services. It's secure, it's easy to use, and doctors can even write prescriptions in certain cases. The Health Choice has a self-service portal, and on that portal you can access your claim history. They don't send explanation of benefits anymore. You'll have to go to the website to get your own EOB. You can look up benefit information. You can order ID cards, review your out-of-pocket expenses, and kind of see where you're at towards the annual out-of-pocket maximum. If you do choose the Health Choice programs, the Health Choice High or the basic program, you have to complete the tobacco-free attestation, which is certifying that you and your family members are not using tobacco products. Go to the healthchoiceok.com website, click on the tobacco-free attestation, and complete the information asked of you, and make sure that you print verification just in case there's some issue down the road. We'll have confirmation that you did complete the attestation. If you have insurance through your spouse and you are double covering yourself or your spouse on insurance, you can complete the annual verification of other insurance at the same time on the tobacco-free attestation website. So you can click on that and complete the information that they're asking about the name of the other insurance company, the policy, et cetera. Okay, dental plans for 2020. The same plans are returning for 2020. No changes to the plan itself. There are some premium increases that's indicated on the slide, but there are no changes to suppliers, plans, or benefits from 2019. Everything remains the same with the slight exception of the premium increase. Vision plans, the 4 carriers are back again this year. Again, no change to the vision plans from 2019. PVCS did have a slight increase. The other providers did not have any increase, and everything remains the same as it is this year. All of the vision plans will include coverage for exam, an allowance for lenses, frames, or contact lenses. Each have their own network, so make sure that whoever you're using is part of your provider's network. If you go outside of the network, there is limited coverage on what they will pay for. Health Choice Life Insurance is available to be increased if you want to do that this year. You can have up to $500,000 worth of life insurance. There's a life insurance application that will need to be completed, and that is available online at the ebd.ok.gov website. Submit the application to Vicki in the HR office, Vicki Crawford in the HR office, and she will forward it on to the Employee Group Insurance Division. Also at this time, you can increase or decrease your dependent life insurance or add it if you don't have it now. And please make sure that your beneficiaries are updated. Things change in your lives and things happen. Make sure all of your beneficiary information is updated. Okay, flexible spending account is used to help you pay for expenses that are not covered by your insurance. So this will help with copays, help with your out-of-pocket, prescription copays, dental copays, anything that's not covered by your insurance that's a medical necessity, you can use FSA dollars for. You must enroll in an FSA account every year. This amount does not roll over. So if you don't do anything for 2020, if you have an FSA account now, you will not have it in 2020. It does require a positive election. The maximum into an FSA account this year is $2,700. That comes out to $225 per month, or $10 a month minimum is the least amount you can put into the account. And there's a couple of real advantages to an FSA account. The first is the money that goes into that account is taken out of your paycheck pre-tax. So that means you don't pay any federal tax, state tax, or Social Security tax on that money. And for most of us, that's about a 30% savings. So right off the top, you're saving 30% of your money that goes into an FSA account. The second real advantage to an FSA is whatever amount you elect for the year for 2020, on January 1st, 2020, you will have that amount loaded onto your debit card, and you could spend that entire amount right away. You do not have to fund the account. In other words, you don't have to put money in there before you can spend it. Whatever amount you choose for the entire year will be available to you on January 1st. You'll have a debit card, and you use it just like any other credit card. If you have to copay for your prescriptions, just give it to the pharmacist. They swipe it just like a credit card, and they take it right out of your account. Now, this does have a use it or lose it feature. So don't put too much money in there that you're not going to spend in the calendar year, because you will lose it if you don't spend it all by March 15th of the following year. So there is a grace period from January 1st to March 15th to utilize any remaining dollars. So if you have FSA dollars in 2019, you have till March 15th of 2020 to use those dollars. Anything left in your account after March 15th, 2020 will be forfeited. Make sure you save your receipts. Occasionally, the HealthScope, the company that manages our FSA account, will ask you for a receipt to validate that it was a valid medical expense. So just save your receipts, and when they request it, send it to them as soon as you can. They will give you 20 days to send in the receipt. If you don't send it in within 20 days, they will give you another 20 days and a second notice. And if you don't send it in by then, they will turn off your credit card till you do. So hang on to your receipts and send them in promptly when you get a receipt request. Okay. Again, you must have a positive enrollment, so you have to go in and elect how much you want to put in for the year. That amount does not roll over. Okay. Mid-year termination, should you leave mid-year, your card will be valid through the last month of your employment, and after that it will be shut off. Paper claims can still be submitted through March 30th of the following year. Dependent care is another flexible spending account. This is used for child care for children 12 and younger. You can use this to pay for their daycare expenses. You cannot use it to pay for tuition, but you can use it to pay for their daycare expenses. Unlike the medical FSA account, this account, you can only use money that you have put into the account. So this account does have to be funded before you can use the benefit. The maximum for 2020 is $5,000 a year, and the minimum is $600 a year. A health savings account is used only with the Health Choice high deductible plan. You cannot have a flexible spending account if you choose the Health Choice high deductible plan. You have to choose a health savings account. And this is a little bit different than an FSA. Again, this only works with the high deductible plan. So the health savings account plan has some different features than the flexible spending account plan. First is you always own that account. That money is always yours. And if you were to leave state employee and go to work somewhere else, you take that money with you. That money never expires. It has a triple tax advantage that you don't pay taxes on the money when you put it into the account. You don't pay taxes on it when you use it. And you have the opportunity to invest the money in that account to grow. So you can invest it in the stock market or bonds, whatever you're comfortable with. And that money also grows tax-free. Okay. American Fidelity Health Services Administration manages the HSA account for us, and the contact information is there on your screen. Once again, you can only use this account if you have the Health Choice high deductible plan. Some forms available on the EBD website. There are additional dependents form if you had a dependent, got married, you want to add somebody to your plan. There are change forms if you want to change anything as far as your dependents go. A common law spousal form if you want to declare yourselves common law and common law marry your partner. There's a form on the website available for that. There's a spousal exclusion form. If your spouse has insurance through another carrier, you can drop them from our insurance, and you'll need to have your spouse sign the exclusion form. And also the life insurance application, if you want to increase your life insurance, that application is on the website as well. Just answer the questions on there and bring it to Vicki Crawford in the HR office, and she has to sign it and forward it on to the group insurance division. Some other online resources, provider directories are on there, so you can search for doctors by zip code, you can search by name, you can search by specialty. There's a comparison guide. You can put 3 health plans into the comparison guide, and you can see them side by side, and that may help you make a decision as to which plan you want to choose. There's also an enrollment calculator, and the enrollment calculator will tell you how much your remaining benefit allowance is or what your out-of-pocket expense is going to be once you put in your preferred insurance company and any other expenses that you have related to insurance. Then the flexible spending calculator will calculate how much you should put into an FSA account if you don't have one now. It just kind of gives you a rough estimate of what you should put into an FSA account. Okay. So to enroll for 2020, go to the ebd.ok.gov website. Sign into the box here on the right, use your 6-digit employee ID number. That number is also on your paycheck stub. If you're not sure what it is, you can also call HR. We'll be happy to provide it to you. Once you put in your 6-digit number, most of us don't remember our password from last year. So click on Forgot Your Password. It'll take you to another screen where you will put in your information and it will reset your password. If you have any difficulty with that, you can call the OMES help desk and they can reset your password for you. Once you're into the system, follow the 12 steps. The first couple of pages, just verifying your personal information. If you change anything on that, your home address, please make sure that you let us know in HR so we can get your address changed in the other systems as well. Once you complete the enrollment, the 12th page will be a review page. You can check out everything, make sure it's exactly what you want. If it's not, you can just go back and make the changes that you need to. If it's exactly what you want, click on submit. You will get a message that says congratulations and the opportunity to print your confirmation of benefits. And you really need to print that. If there's any discrepancy between what you think you've submitted and what's in the system, come 2020, we will need that for verification. So please make sure that you do print your confirmation of benefits. If you make your elections and next week you decide to go back and change it for whatever reason, all you have to do is go through the 12 steps all over again. You could do that as many times as you want between now and October 31st, but whatever's in the system on midnight, October 31st, is what you're going to have for 2020. So even if you want to keep the same insurance that you have now, it's a good idea to go through and review it, make sure that everything is the way it's supposed to be, especially if you are going to take an FSA account, a flexible spending account, you will need to make a positive election again for that. Okay. All right, if you have any questions, you can please contact myself or Vicki Crawford at the phone numbers on your screen. Appreciate it. Take care and have a good afternoon.